Many people expect serious health problems to arrive with dramatic symptoms. Sharp pain, sudden weakness, a medical emergency that demands immediate attention. But the human body rarely works that way. More often, it whispers before it shouts. And one of those whispers can appear in your feet long before you ever suspect a problem with your blood sugar. Take a moment and think about what your feet look like at the end of a normal day. Do they seem more swollen than they used to? Maybe your socks leave deep marks around your ankles. Perhaps your shoes feel tighter by evening, even though they fit perfectly in the morning. It's easy to blame that on standing too long, hot weather, or simply getting older. And sometimes that's exactly what it is. But persistent swelling shouldn't be ignored, especially when it begins happening more frequently or is accompanied by other unusual symptoms. Your circulatory system works around the clock, delivering oxygen and nutrients to every tissue in your body. When circulation isn't working efficiently, fluid can begin collecting in the lower legs and feet because gravity naturally pulls it downward. That's one reason healthcare professionals pay close attention to changes in the feet. They can sometimes provide valuable clues about what's happening elsewhere in the body. If swelling appears suddenly, becomes severe, affects only one leg, or comes with chest pain or difficulty breathing, it's important to seek medical care promptly, as those symptoms can have causes that require urgent evaluation. But even gradual swelling that's becoming a regular pattern deserves a conversation with your healthcare provider. Now here's something that often catches people completely off guard. Some individuals don't notice swelling first. They notice that their feet feel unusually cold, even during warm weather. They put on an extra pair of socks. They rub their feet together beneath the blankets. Yet somehow, they never seem to warm up. Have you ever experienced that? Cold feet aren't always a sign of poor circulation. Sometimes the room is simply cold. Sometimes it's completely harmless. But when one or both feet are consistently colder than the rest of the body, particularly if this is a new change, it's another detail worth paying attention to. Healthy circulation delivers warm blood throughout the body. When that process changes, temperature differences may become more noticeable. Many people dismiss this because it develops so gradually. They adjust. They buy thicker slippers. They use warmer blankets. Life goes on. But your body notices every change, even when you don't. That's why small observations matter. Individually, they may seem insignificant. Together, they can begin telling a much larger story. Now let me ask you another question. Have you ever looked at the bottom of your feet and noticed a thick patch of hard skin? Maybe beneath your heel. Maybe near the ball of your foot. Maybe under your big toe. Most of us call these calluses. They're extremely common, especially as we age. In many cases, they're simply the result of repeated pressure or friction. But when calluses become unusually thick, continue growing, or repeatedly develop in the same location, they deserve a closer look. Why? Because pressure points on the feet can become problematic when combined with reduced sensation or slower healing. A callus itself isn't usually dangerous. The concern is what might be happening underneath it. If excessive pressure continues without being noticed, the skin beneath can become irritated or damaged. That's one reason podiatrists often recommend properly fitted footwear and routine foot examinations for people living with diabetes. It's a simple habit that may help identify small issues before they become much larger ones. And while we're talking about your skin, there's another change that many people mistake for nothing more than aging: a change in color. Have you noticed areas of your feet appearing darker than usual? Or perhaps unusually pale? Maybe they occasionally look slightly reddish or even bluish after sitting for a long time. Skin color naturally varies for many reasons: temperature, activity, even the position of your legs. But persistent color changes should never be ignored. Your skin reflects what's happening underneath it. Changes in blood flow, inflammation, infection, or other medical conditions can all influence how your feet look. That's why doctors don't simply ask patients whether their feet hurt. They actually examine them. They look at the skin, the nails, the temperature, the color, the shape. Sometimes those visual clues reveal far more than the patient realizes. And speaking of nails, here's something surprisingly common. Many people begin noticing their toenails becoming thicker, more brittle, harder to trim, or changing color over time. Often, the first thought is a fungal infection. And in many cases, that's exactly what it is. But recurring nail problems can also become more common in people whose blood sugar has been elevated over time because changes in circulation and the body's natural defenses can make infections easier to develop and harder to clear. Again, this doesn't automatically mean diabetes. It simply means that recurring or stubborn nail changes shouldn't be ignored, especially when they appear alongside several of the other warning signs we've been discussing. You may have noticed a pattern by now. None of these signs alone can diagnose diabetes. That's not their purpose. Their value comes from recognizing the bigger picture. One small symptom may have many possible explanations, but several symptoms appearing together, that's when the conversation changes. That's when it's worth asking your healthcare provider whether testing your blood sugar would be appropriate, because diabetes often develops quietly, sometimes for years, without causing obvious pain, without making headlines in your daily routine, until one day, the small whispers become impossible to ignore. But there's one warning sign that many people never expect. In fact, some don't even connect it to their feet at all. Yet when doctors see it alongside the other changes we've discussed, they pay very close attention. And that's exactly where we'll continue next. Sometimes, the most important warning signs aren't the ones you can see. They're the ones you can feel. Not pain exactly, but something that simply doesn't feel normal anymore. Have you ever climbed into bed after a long day, only to notice an unusual burning sensation in your feet? Not because they were too close to a heater. Not because you exercised. Just a strange warmth that seems to come from inside. For some people, it feels like their feet are resting on hot sand. Others describe it as a mild burning that slowly becomes more noticeable at night. And that's what makes it so frustrating. During the day, distractions keep your mind occupied. But once everything becomes quiet, the sensation becomes impossible to ignore. Doctors believe this can happen because damaged nerves sometimes send abnormal pain signals even when there's no injury at all. The brain receives those signals and interprets them as burning, stinging, or aching. Some people even notice that the weight of a bedsheet resting gently on their feet becomes surprisingly uncomfortable. A touch that never bothered them before suddenly feels irritating. Others experience the opposite. They can barely feel the sheet at all. That's why nerve changes can be so confusing. They're different for everyone. Some people experience increased sensitivity. Others lose sensation completely. And many experience both at different stages. If burning sensations become frequent or start interfering with your sleep, don't simply assume it's a normal part of aging. It's worth bringing up during your next medical appointment. Now here's another question. When was the last time you actually looked at the bottom of your feet? Not quickly. Not while putting on your shoes. I mean, really looked. Most people don't. And that's understandable. As we get older, flexibility isn't what it used to be. Looking underneath our feet isn't exactly part of most morning routines. But here's why it matters. Many people discover small cuts, tiny cracks, or blisters without having any idea how they got there. Think about that for a moment. An injury that happened without you noticing it. That alone tells doctors something important. Because healthy nerves normally alert us immediately. You step on something sharp, you pull your foot away. Your body's alarm system does its job. But when sensation decreases, those alarms become quieter. Sometimes dangerously quiet. That's why healthcare providers often encourage people at risk for diabetes to inspect their feet every day. Not because they expect to find something serious, but because catching a small issue early is almost always easier than treating a larger one later. A simple hand mirror, a family member, or even the camera on your phone can make checking the bottoms of your feet much easier. It only takes a minute, yet it can reveal changes you might otherwise miss completely. Now let me mention something that surprises many people. Foot pain isn't always caused by damaged nerves. Sometimes the pain comes from something much simpler: poorly fitting shoes. If circulation or sensation has changed, shoes that once felt comfortable may begin creating pressure in places they never did before. A tiny area of repeated rubbing, day after day, can eventually become a blister or sore. And if sensation has been reduced, you may continue wearing those same shoes without realizing they're causing harm. That's why properly fitting footwear becomes increasingly important with age. It's not about buying expensive shoes. It's about reducing unnecessary pressure and protecting the skin you've worked so hard to keep healthy. Many podiatrists recommend checking the inside of your shoes before putting them on. A small pebble, a folded insole, or even a rough seam can become a problem if it stays there long enough. Simple habits often make the biggest difference. Speaking of simple habits, let's talk about something many people overlook completely: hydration. Our skin depends on moisture from both the outside and the inside. While drinking more water isn't a treatment for diabetes, staying well hydrated supports many normal body functions and overall health. Likewise, moisturizing dry feet, while avoiding lotion between the toes where excess moisture may encourage fungal growth, can help protect the skin's natural barrier. These aren't miracle solutions. They're everyday habits that support healthy foot care. And that's an important distinction. Managing diabetes isn't about one magical food, one special drink, or one overnight trick. It's about consistent habits practiced over time. Small decisions, repeated every day. Now, before we move on, there's one mistake that healthcare professionals see over and over again. Someone notices tingling, or numbness, or a small wound. But because it doesn't hurt, they decide to wait. Maybe another week, maybe another month. Eventually, another symptom appears. Then another. Only then do they schedule an appointment. The reality is that early conversations with your healthcare provider are often far more valuable than waiting until symptoms become severe. Sometimes the cause turns out to be diabetes. Sometimes it's something entirely different, such as a vitamin deficiency, medication side effects, circulation problems, or another condition that also deserves attention. Either way, knowing is always better than guessing, because your body has an incredible way of sending signals long before serious complications develop. The challenge is learning to recognize those signals while there's still time to act. And there's one final warning sign that many people never connect to diabetes because it doesn't involve pain. It doesn't involve tingling, and it doesn't even involve the skin. Yet when doctors see it alongside everything we've talked about today, it often completes the picture. And it's probably the most overlooked sign of them all. One final question. Have you ever noticed that your feet seem different? Not because they hurt, not because they tingle, but because they simply don't look the way they used to. Perhaps the muscles appear smaller. Maybe your toes seem slightly different in shape. Or you notice that certain shoes no longer fit the way they once did. These gradual structural changes often happen so slowly that they're easy to overlook. You see your feet every day. Small differences become familiar. And because they happen little by little, your brain treats them as normal. But healthcare professionals know that long-term nerve problems can sometimes affect the small muscles in the feet. When those muscles no longer receive normal nerve signals, they may gradually weaken over time, changing the way pressure is distributed while walking. That doesn't happen overnight. It develops slowly, which is exactly why routine foot examinations become more important as we age. The earlier these changes are recognized, the easier it becomes to protect the feet from unnecessary pressure and injury. Now, let's pause for a moment. We've talked about tingling. We've talked about numbness, dry skin, slow healing, swelling, cold feet, changes in skin color, burning sensations, and gradual changes in the appearance of your feet. Individually, none of these signs can confirm diabetes. That's an important point. Many different conditions can cause similar symptoms, including circulation problems, vitamin deficiencies, arthritis, nerve compression, skin conditions, or even certain medications. But when several of these signs begin appearing together, especially alongside symptoms like increased thirst, frequent urination, unexplained fatigue, blurred vision, or unintended weight loss, that's when it's wise to speak with your healthcare provider. A simple conversation today may help prevent much bigger problems tomorrow. One of the biggest misconceptions about diabetes is that you'll always feel sick. In reality, many people continue living their normal lives for years before receiving a diagnosis. They go to work, spend time with family, take care of grandchildren, enjoy retirement, all while subtle changes are quietly taking place beneath the surface. That's why awareness matters, not fear. Awareness. Because fear causes people to panic. Awareness encourages people to take action. And those are two very different things. If you're over 60, consider making foot checks part of your weekly routine. It doesn't need to be complicated. Take a minute after your shower. Look at the tops of your feet. Check the soles. Notice the heels. Examine the spaces between your toes. Pay attention to your toenails. Look for cuts, blisters, redness, swelling, changes in color, or anything that seems unusual. If reaching your feet is difficult, use a hand mirror or ask a trusted family member to help. It's a simple habit that takes very little time but can help you notice changes earlier. Just as important, wear shoes that fit properly. Avoid walking barefoot in places where you could accidentally injure your feet. Keep your skin clean and moisturized, while avoiding excess moisture between the toes. Trim your toenails carefully, or seek professional foot care if you have difficulty seeing or reaching them. And if you've already been diagnosed with diabetes, follow the foot care advice provided by your healthcare team. Regular checkups, good blood sugar management, staying physically active within your ability, eating a balanced diet, and taking medications as prescribed all play an important role in protecting your overall health, including your feet. Remember, your feet carry you through every stage of life. They've supported you through decades of work, family, celebrations, challenges, and countless ordinary moments that often become the most meaningful memories. They deserve your attention. Not because something is necessarily wrong, but because paying attention today may help protect your mobility and independence for years to come. If you recognized one or more of the signs we discussed today, don't panic. Instead, consider it an opportunity to ask questions, to schedule a checkup, to understand what's happening inside your body rather than making assumptions. Early answers are almost always better than late surprises, and sometimes that single decision to seek medical advice becomes the turning point that helps someone avoid complications later in life. Thank you for spending these moments with me. If you found this video helpful, consider sharing it with a parent, a spouse, a friend, or someone over 60 who might benefit from learning these warning signs. You never know whose life could be positively affected by a simple conversation. Take care of your feet, take care of your health, and most importantly, never ignore the quiet signals your body is trying to give you.